Certain commonly prescribed medications can quietly strain the aging heart, particularly in older adults, because the cardiovascular system becomes more sensitive with age. As people grow older, natural changes occur in the heart and blood vessels. The heart muscle may stiffen slightly, the electrical system that controls heartbeat can slow down, and blood vessels may lose flexibility. These changes do not always cause immediate problems, but they reduce the heart's ability to adapt to stress. When medications are added to this already sensitive system, even drugs that are widely considered safe can create hidden risks over time. One of the most important reasons this happens is that the body processes medications differently in older age. The liver, which helps break down many drugs, often works more slowly. The kidneys, responsible for filtering medications from the blood, may also lose efficiency. In addition, aging changes body composition by reducing muscle mass and increasing fat stores, which affects how drugs are distributed in the body. As a result, medications may stay in the bloodstream longer or reach higher levels than intended. This prolonged exposure can place ongoing strain on the heart, even when the medication dose has not changed. Many of the medications that can affect the heart are commonly prescribed and used daily by millions of older adults. Certain pain-relieving drugs, especially some anti-inflammatory medications, can increase blood pressure, cause fluid retention, and reduce kidney function. These effects force the heart to work harder to pump blood, gradually increasing stress on the heart muscle. Over time, this can contribute to worsening heart function, particularly in individuals who already have high blood pressure or underlying heart disease. Other medications, including those used to treat blood pressure or heart rhythm disorders, can also become problematic if not regularly reviewed. While these drugs are often life-saving, improper dosing or long-term use without adjustment can slow the heart rate too much or interfere with the heart's electrical signaling. In older adults, this may lead to dizziness, fainting, weakness, or irregular heartbeats. Because these symptoms may appear gradually, they're often overlooked or attributed to normal aging rather than medication effects. Medications used for sleep problems, anxiety, muscle relaxation, or nerve pain may also indirectly affect the heart. These drugs can lower blood pressure excessively, suppress breathing during sleep, or reduce the body's ability to respond to stress. During the night, when heart rate and blood pressure naturally fall, these effects can place additional strain on the cardiovascular system. In older adults, this can increase the risk of nighttime heart rhythm disturbances or reduced oxygen delivery to the heart muscle. A major contributing factor to medication-related heart damage in seniors is polypharmacy, which refers to taking multiple medications at the same time. Many older adults manage several chronic conditions and may take 5, 10, or even more medications daily. Each drug may be appropriate on its own, but interactions between medications can amplify side effects. These interactions may affect heart rhythm, blood pressure regulation, or fluid balance, increasing cardiovascular risk without clear warning signs. One of the most concerning aspects of medication-related heart strain in seniors is how silently it can develop. Unlike a sudden heart attack, medication-induced stress often progresses slowly. Older adults may notice mild fatigue, reduced stamina, shortness of breath during routine activities, or subtle swelling in the legs. These symptoms are frequently dismissed as part of getting older, delaying medical evaluation. Over time, this silent progression can contribute to heart muscle weakening, worsening heart failure, or dangerous rhythm abnormalities. The electrical system of the heart is especially vulnerable in older adults. Certain medications interfere with the movement of ions that control heartbeat timing. While younger hearts may compensate for these changes, older hearts often cannot. This can lead to irregular heart rhythms, such as atrial fibrillation or excessively slow heart rates. These rhythm disturbances reduce the heart's efficiency and increase the risk of blood clots, stroke, and sudden cardiac events.
In many cases, these rhythm problems occur intermittently, making them difficult to detect with proper monitoring. Long-term medication use further increases risk because the body's tolerance changes over time. A drug that was safe and effective at age 50 may no longer be appropriate at age 75. Unfortunately, many prescriptions are renewed automatically for years without a comprehensive review. This lack of reassessment can allow harmful effects to accumulate slowly. As health conditions change, the balance between benefit and risk may shift, particularly for the aging heart. Another challenge is that older adults may not report side effects clearly. Feelings of fatigue, lightheadedness, or weakness are often minimized or accepted as normal aging. In reality, these signs may indicate that the heart is under strain from medications. Without open communication and regular evaluation, these warning signs can be missed until more serious complications develop. This is why regular medication review is essential for protecting heart health in older adults. Periodic evaluation by a healthcare professional allows doses to be adjusted, unnecessary drugs to be discontinued, and safer alternatives to be considered. Heart monitoring, including blood pressure checks, heart rate assessment, and occasional rhythm testing, can help identify early signs of medication-related stress before permanent damage occurs. In summary, commonly prescribed medications can quietly strain the aging heart because of age-related changes in drug processing, increased sensitivity of the cardiovascular system, and the cumulative effects of long-term and multiple drug use. The danger lies not in dramatic, immediate reactions, but in slow, silent progression that may go unnoticed for years. Awareness, regular medical review, and careful monitoring are essential to ensure that medications continue to support health rather than compromise the heart as people age.
Natural aging already places significant demands on the heart, even in healthy older adults. As the body grows older, the heart muscle may become less flexible. The walls of the heart can thicken slightly, and the blood vessels often lose elasticity. These changes make it harder for the heart to pump blood efficiently and respond to physical or emotional stress. While many older adults live well with these changes, the aging heart has less reserve capacity. This means it is more vulnerable to additional pressures, including those caused by certain medications. When risky medications are added without careful monitoring, the combined effect can accelerate heart decline. Many drugs affect blood pressure, heart rate, fluid balance, or the electrical signals that control heartbeat. In younger individuals, the heart can usually adapt to these effects. In older adults, however, these same changes can overwhelm the heart's reduced adaptive capacity. Medications that slightly raise blood pressure or heart rate may force the aging heart to work much harder over time, increasing wear on the heart muscle. Another important factor is that aging organs process medications more slowly. The liver and kidneys, which are responsible for breaking down and removing drugs from the body, often lose efficiency with age. This can cause medications to build up in the bloodstream, even when taken at normal doses. As drug levels rise, their effects on the heart become stronger and more prolonged. This increases the risk of low or high heart rates, abnormal rhythms, and excessive strain on the heart's pumping function. The problem becomes even serious when older adults take multiple medications at the same time. Managing several chronic conditions often requires a combination of drugs, each with its own effects on the cardiovascular system. Drug interactions can intensify side effects, leading to sudden drops in blood pressure, irregular heartbeats, or excessive fluid overload. These interactions may not cause immediate symptoms, allowing heart stress to progress silently for months or even years. One of the most dangerous aspects of this combined effect is how subtle the warning signs can be. Older adults may experience fatigue, mild shortness of breath, dizziness, or swelling in the legs.
These symptoms are frequently attributed to aging rather than medication-related heart stress. As a result, medical attention may be delayed, allowing heart function to decline further. By the time clear symptoms appear, significant damage may already have occurred. The electrical system of the heart is particularly vulnerable to the combined effects of aging and medications. Certain drugs interfere with the signals that regulate heart rhythm. In an aging heart, these disruptions can trigger irregular rhythms, such as atrial fibrillation or excessively slow heartbeats. These rhythm disorders reduce the heart's efficiency and increase the risk of blood clots, stroke, and sudden cardiac events. Without monitoring, these rhythm changes may go undetected until a serious complication arises. Long-term medication use without regular reassessment further increases risk. A medication that was safe and effective earlier in life may no longer be appropriate as the heart and other organs age. Continuing such drugs without adjustment can gradually accelerate heart decline. Unfortunately, many prescriptions are renewed routinely without a comprehensive review, increasing the likelihood of harm over time. In summary, natural aging already challenges the heart by reducing its flexibility, efficiency, and ability to respond to stress. When potentially risky medications are added without proper monitoring, their combined effects can speed up heart deterioration and increase the likelihood of serious cardiac events in older adults. Regular medication review, careful monitoring, and early recognition of subtle symptoms are essential to protect heart health and prevent avoidable complications as people age.